Namaste everyone. Myself, Dr. Rakeshkumar Gujar, currently working as Assistant Professor in the Department of Shalyatantra, that is Surgery, at BLD Association's AVS Ayurveda Mahavidyalaya, Vijaypura, Karnataka, India. And also working as visiting Ayurvedic consultant surgeon at Gujar International Ayurveda Foundation's Ayurveda Ashraya, Bengaluru and Vijaypura, Karnataka, India. I welcome you all for this 39th International Global Ayurveda Conference, which is held on the topic pain, the concept of pain in Ayurveda, or the pain management. Today's topic of discussion is the concept of pain in Ayurveda with its management. I'll be dealing with this topic. So let us start the session, which is on the topic concept of pain in Ayurveda with its management. I'll just present my slides. So here is the screen. The concept of pain in Ayurveda with its management. As I gave my introduction, I completed my master's in Ayurvedic surgery and also currently pursuing my PhD from Rajiv Gandhi University of Health Sciences, Bengaluru, Karnataka, India. The contents of my slides are starting with the introduction, then the basic concepts of pain, then the types of pain, mechanism of pain, pain in different elements, in different diseases, pain management. So these are the contents of my topic. Targets of this lecture is theoretical knowledge, the clinical skills, the practical applicability of Ayurvedic concepts. These are the targets of this lecture. At the end of this lecture, you will definitely know about the concept of pain, the Ayurvedic approach of pain, the management of pain. So these are the points which you will get at the end of this lecture. So here is the first slide, which starts with the introduction. The pain is the most important symptom which brings the patients to the doctor. Pain is the most important symptom because the pain is the only symptom which can bring the patients to the doctors. Because of pain only, the patients are coming to the doctors. The pain might be related with any other different concepts, any other different diseases, but the only symptom which brings the patients to the doctor is related with the pain. The pain is the most important or the cardinal symptom which brings the patients to the doctor. So today's topic is also related with the pain, which is most of the important concept related with the diseases. Pain is of different kinds and of different nature with the different associated features. The concept of pain in Ayurveda is completely different as compared with the contemporary science, that is the modern science. So here are some of the images which are showing that the sites of different sites of the pain. The basic concepts of a pain. The pain is a distressing feeling often caused by the intense or damaging stimuli. The International Association for the Study of Pains widely used the definitions Like, the pain is defined as an unpleasant sensory and emotional experience associated with or resembling the associated with actual or potential tissue damage. So whenever there is the actual or the potential tissue damage, that will be called as the pain. In medical diagnosis, pain is regarded as a symptom of underlying condition. So here are some of the basics of pain. In Ayurveda, the pain is called with different terminologies. The first one, as it is Ruk. Ruk is called as pain. Shula is also one of the terms which is used to denote the pain. Vedana is another term which is again used to denote the pain. Pida is also the another term which is used to denote pain. Dukkha is also the pain. So these are the different terminologies which are used to denote the pain. Types of pain. So there are different types of pain. Starting with the duration, the pain can be classified into the acute, subacute, and the chronic one. The nociceptive pain, the neuropathic pain, the psychological pain, breakthrough pain, that is, for example, can be the oncological pain related with the cancers. Pain asymbolia, for example, is the diabetic neuropathy. So these are also different types of pains. So what actually means the nociceptive pain? Nociceptive pain means it is caused by when the noxious stimulus is perceived by the free nerve endings of afferent sensory nerve axons. The nociceptive pain might be of fast pain, which is a sharp and slow pain, which is diffuse and dull-liking. So the nociceptive pain is of two types, as the fast pain and the slow pain. The location of the pain. Depending upon the location of the pain also, we can classify the pain in different types, as the nociceptive pain, which is a somatic one, which can be again of two types, as the superficial and deep, and also the visceral one. So the superficial pain means which is related with the skin and up to the fascias, which is the subcutaneous tissue also. So all these types of superficial pains can be classified into the nociceptive pains, which are superficial one. The deep pains, for example, the deep pains are related with the muscles or the bones. So these are the deep pains. The visceral pain, visceral means it is related with the world. The viscera is the organs. The abdominal organs can be called as the viscera. The pain which is related with the viscera or the abdominal organs can be the visceral pain. For example, the pain in the stomach. The pain in the stomach or pain in the abdomen can be because of the ulcers or the peptic ulcer. So the pain which is related with the different organs, the peptic ulcer pain, the hunger pain which is related with the peptic ulcers, can be called as the visceral pain. Depending upon the receptors, again the nociceptive pain can be classified into the thermal one, the mechanical one, the chemical one. The thermal pain, the pain which is related with the heat or the cold items. Whenever the patient is coming in contact with the heat, he will feel the thermal pain. Mechanical pain. When the tissues are stretched or when the tissues are having pressure, the mechanical pressure can be the mechanical pain. The chemical pain, which is related with the chemicals, iodine chemicals cause the pain. So these are some of the classifications of pain. Just a simple concept I will explain you about the pain. What actually the pain means. Today I'm giving a lecture on the concept of pain. I'm sitting on this chair. Sitting on the cushioned chair for a longer duration will not at all cause much pain. But sitting on the simple, hard, wooden chair for a longer duration, which is not at all having the cushions, will cause the pain in your hips, in your buttocks. Why the pain happens whenever we are sitting for the longer duration on the uneven or on the hard surface will cause the pain. The concept is that whenever there is the pain can be because of the mechanical pressure, as I said. This mechanical pressure can be because of actually the ischemia. That is, the tissues will be dying. It is the pain which is caused because of dying cells. Your cells are actually dying. How? It is whenever you are sitting on the wooden place or wooden chair for a longer duration, your ischial bone will come in contact with the skin, your skin. Ischial bone to the skin. We all are sitting on the ischial bone. The bone which we are used to sit is the ischium. So this ischial tuberosity or the ischium bone is coming in contact continuously under pressure. So this bone, after this bone, there is some of the tissues. After this tissue, there will be the skin. So as we are sitting on the wooden piece, the hard surface for longer duration, the tissues in between the bone and the wooden piece will get compressed. When the tissues are being compressed, there will be the ischemia. The blood will be not at all completely perfusing. When the blood circulation is not happening in between the tissues, then what happens? The tissues will get lack of nutrition. The nutrition is not at all supplied. So because of this, there will be the development of ischemia. Ischemia means there is the loss of blood to the tissues. So because of this compression. So when this compression continues, the tissues will start dying. So the person who is sitting will gradually, subconsciously, unknowingly changes his position of sitting. He will just sit down like this. Means the position will be changed. This position or the subconscious change of this position of a longer sitting is again because of the ischemia which is happening. It will get reduced. To reduce the ischemia, the position is changed. This is the basic concept. So the pain is because of the dying nerves. The dying nerves are causing the pain. The dying cells are causing the pain. So pain is the important symptom which is bringing to the doctors to have the diagnosis of the underlying pathology. What's the disease is, why it is causing the pain. So the cause of pain is important. The diagnosis of the pain is important. So let us see the next slide. So the types of pain according to Ayurveda. So according to Ayurveda, the types of pain are Vataja Shula, Pittaja Shula, Kaphaja Shula. So just I will say you what actually this Vata means. Vata means it is the wind-like object. It is not actually the visible thing. This Vata is not at all visible, but we can perceive it by its functions. What's meant by Pitta? Pitta is the one thing which is related with the happenings which are causing the digestion, the metabolism, all the digestive procedures or proceedings which are taking place in our body is because of the Pitta. What is meant by Kapha? Kapha means it is the binding object. So whether this Vata, Pitta and Kapha are all there in the body? Yes, it is. In our body, we are having these three doshas. The concept of three doshas can be well understood with a small atom also. How it is? We have the protons, we have the neutrons, we have the central core, we have the space, all these things. So we can correlate this atom with the Panchamahabhutas. So this body is Panchamahabhutatmaka. Vataja Shula means it is causing the pain. Generally, all the types of pains are related with the Vata. The Vata can be associated with the Pitta and the Kapha also. But main thing which is causing the pain is the Vata. The Vata is the main thing which is causing the pain. So here are different features related with the Vata, Pitta and Kapha. The features are say like the time of onset. When there is the onset of this Vata Shula or the pain which is related with the Vata. It is when after digestion of the food, we will have this pain which is caused by Vata. After digestion of the food, it will be there. Or in the evening time, we will have this Vata Shula, Vata pain. Pitta can cause the pain during the digestion or in the mid-noon or in the midnight. So the Pitta Shula will be there. Or just after the food or after the meals or in the morning time, we will be having the pain which is because of this Kapha dosha. The characteristic features or character of this Vata Shula is the pricking and piercing type of pain. The pricking type of pain or the piercing type of pain is because of the Vata. The Pitta Shula is because of the burning sensation. The burning sensation can produce because of this Pitta dosha. The heaviness is there because of the Kapha dosha. Means the character which is related with the Vata is pricking and the piercing type of a pain. The character which is related with the Pitta is the burning sensation. The character which is related with the Kapha which is the heaviness. The heaviness can be because of this Kapha dosha. The aggravating factor for this Vata dosha can be cold one. The cold atmosphere can increase or aggravate the symptoms of Vata type of pains. The rainy season can also aggravate the Vata. The autumn season can aggravate the Pitta. It's called as the Sharad Ritu or the Grishma Ritu or the summer season can aggravate the Pitta dosha. This is Atman, the Sharad Ritu. Kapha can aggravate its symptoms in again the cold seasons. The intensity of a pain, which is related with the Vata, is fluctuating, means it may be increased at some time and it may come down just after some duration. Means it is not actually always a fixed one. It is always changing. The changing is the characteristic feature of the Vata. The intensity of the pain will increase or decrease. It is not at all a steady one. It is related with the Vata. When it is less as compared to the others, it is because of the Kapha dosha. The intensity is not so increased or not so dull. It is in between the Vata and the Kapha, that is Pitta. So these are the intensities of pain. So see over here, you can see the mechanism of the pain. The mechanism of the pain. The nociceptive pain is caused by the stimulation of the somatic nerve fibers that respond to stimuli approaching or exceeding harmful intensity, that is the nociceptors, and may be classified according to the mode of noxious stimulation. So this is the mechanism of pain which is related with the nociceptive pain. The neuropathic pain. The neuropathic pain is caused by damage or disease that affecting any part of the nervous system involved in bodily feelings, the somatosensory system. The neuropathic pain may be divided into the peripheral, central, or mixed. That is a peripheral and the central neuropathic pain. The peripheral neuropathic pain is often caused or described as the different burning sensations, the tingling sensation, the electrical stimulation, the stabbing, or the pins and the needles. So these different nature or different kinds of pain might be because of this peripheral neuropathic pain. The mechanism of nociplastic pain. The nociplastic pain is pain characterized by a changed nociception, but without evidence of real or threatened tissue damage, or without disease or damage in the somatosensory system. So there is no any evidence that there is the damage to the tissues, but still there is the pain. That's the nociplastic pain. The mechanism of pain which is related with the psychological pain is called as the psychologia. The psychologia is a form of a pain. The somatoform pain is caused by the increased or the prolonged by the mental, emotional, or behavioral factors. The headache, the backache, and the stomach pains are sometimes diagnosed as the psychogenic one. Sufferers are often stigmatized because both medical professionals and the general public tend to think that pain from the psychological source is not real. So here we can see the pain in different elements. So there is the Vata Gulma, means the stomach pain that can be producing the Thoda type of a pain, pricking type of pain. Kitiba is one of the type of the kusta wherein there will be severe pain, tivra vedana. Kakanaka kusta can be the tivra vedana, again the severe pain, one of the type of the kusta, that is the skin disease. Kostakashrishya vata. So Kostashrita vata can be the vata which is residing inside the costa or in the GIT, can produce the pashvashula, that is the pain in the flanks. Gudagata vata, the vata which is sited in the Guda Pradesha, that is the anus or the rectal region, can produce the udarashula, that is the pain, abdominal pain. Amashagata vata can produce the hridaya, nabi, and parshva, that is the pain can be because of this vata which is situated in the amashaya, or we can just correlate the word as the stomach. It can produce the pain in the heart region, in the flanks, or in the whole abdomen. Akvashegata Vata, that is the pain which is residing in the large intestines or the intestines, can produce the pain in the abdomen. Tvaggata Vata can produce the Parshvarukka. Raktagata Vata can produce Tivra Vesanam. So these are the different types of pains. The main thing is here the Amavata, which is called as, or which we can correlate with up to some extent, that the rheumatoid arthritis can have the pain like the Vrishchikadamshavat, the scorpion sting like pain. So these are the different kinds of pain, different types of pains which are related with different elements, different diseases. So here we can see the management of pain, how we can manage the pain. We can manage the pain by the concept of guna. Guna means it is the characteristic features which are related with the Vata dosha, the Pitta and the Kapha. Or the concept of rasa. Concept of rasa means it is, the meaning of rasa is the taste. The different types of tastes will be present in different objects, in the different vegetables, in the different eatables, in the different food. So depending upon taking of or intake of a particular taste food, for example, we are having 6 types of tastes in Ayurveda: sweet, madhura; sour, amla; salty, it is lavana; katu, it is the pungent, chili; hot; tikta, or bitter; kashaya, very astringent. So these 6 types of rasas, or 6 types of the tastes, can alter the pain or can make out the equilibrium of the Vata, Pitta and Kapha. Mainly here we are using Madhura, Amla, Lavana, that is the sweet, sour and the salty one, to reduce the Vata dosha so that we can manage the pain. Vedana Sthapana Dravyas are explained, means the drugs which can reduce, which can make out or which can reduce the pain, or Vedana Sthapana Dravyas. Angamarda Prashamana, which can relieve the body aches. Drugs are explained in Charaka Samhita. Shulahara Dravyas, which can reduce the pains, are also explained in the Ayurveda. So we can use the concept of guna, that is Vata dosha can be reduced by using some of the gunas, some of the characteristic drugs which can elevate, which can reduce or mitigate the Vata dosha can be used. The concept of rasa, the concept of taste can be helpful. The Vedana Sthapana Dravyas are different types of drugs can be used to reduce the pains. Apart from this, we can also go for the management of pain with these different modalities for treatment. I'll be explaining all these things in a nutshell, in a very simple way. Snehana, which is called as the iolation therapy; Swedana, which is the fermentation or the steaming therapy; Shastra Karma, which is the operative surgical management; Agni Karma, which is the cauterization therapy; the Jalavkacharana, using the leeches or the leech therapy; Siravedana, which is called as the blood letting therapy; with the Agni Karma, which is called as the production of Agni, the combination of the Agni with the Vidya, with the piercing with Agni Karma can be called as the Vidya Agni Karma. The Basti, which is the concept of giving the enemas or the concept of staying out some of the medications over the particular site for the duration, for the optimal duration, is the Basti. The Marma Chikitsa can be called as up to some extent. So we are using some of the vital points or vital sites of the body to have the relief from the pain. Lepana, to have the external applications over the painful areas. Harshana, which is called as the delightful or the pleasureful or the happyful therapy, the pleasure therapy, keeping the persons or the patients in a very delighted or pleasureful ways can reduce the pain. Ashwasana, giving the assurance to the patient that nothing will happen, giving the positivity to the patient, giving the assurance or the positivity towards the diseases, that it will come down and he will get rid of all the diseases, can reduce the pain. Just the ashwasana, the assurance can reduce the pain. So these are the different modalities which are used in the treatment of pain in Ayurveda. So let us see just the gist of all these things. So here, the management of pain with Snehana. On the left side of your screen, you are seeing that the vessel is there wherein the oil will be put on or the medications will be put on over the forehead region to relieve the headaches, different types of migraines, or different diseases which are related with the pain of the head region. On the upper side and the superior portion and the central image is showing that he is drinking something, that drinking of the sneha or drinking of the medicated oils or the ghees can reduce the pain. You can see on this right side, on this right side of the screen, that here on that side, this side, on the right side, there is the Karnapurna, means putting the oil inside the ears can relieve the pain which is caused because of the Karnaguta or because of the wax. It can reduce the pain when it is related with the earache. The earache can be reduced by using the medicated oils or gritas or by pouring inside the ears. We can use the oils for external therapies. Snehana means we are using the oils or the ghees. The medicated oils or ghees are used to relieve the pain. This is the Abhyanga, which is on the left side of the screen. In the central part, you can see that Abhyanga means oil massage. Here on the right side, you can see that the cap has been owned for the patients, and we are inserting or filling that cap with the oils. It is called as the Shirodhara procedure. Again, it is a cold calming therapy which can reduce the pain, which can relieve the blood pressure. So different pains can be managed with this Shirodhara or the Shiro Basti, it is called as. Here you can see the oilation to the Padabhyanga. Padabhyanga means we are massaging the foods with the oils, medicated oils. It can reduce the pain. It can improve the eyesight. So the relationship between this Padabhyanga, that is the foot massage with oils, and the improvement in the eyes are noticed with, you can just search it on. There are different theories or articles have been published on it. Just by drinking the medicated ghees can also reduce the pain. Using different conditions, different ailments can be used, different ailments will be just get rid of by using these things. That is the management of pain with Snehana or oil therapy or the ghees. Thus you can see the management of a pain with the Svedana, which is fermentation. Here you can see that over the knee joint there has been the pot, like the duff has been prepared and the oil has been filled in. It is also one of the type of the Janu Basti, it is called as, wherein the oilation is also going on along with that Svedana. There is a fermentation will also be going on. Snehana and Svedana will be going on here, which can reduce the pain which is caused because of the osteoarthritis. Here we can see that the Svedana, which is called as the Shashtika Shalipinda Sveda, here it is. the rice, particular rice, Shashtika Shali is used, and it will be made with the rice, and the potali or the coverage will be made, and it will be heated with the lukewarm heating will be done, and it will be applied over the painful areas, which can reduce the pain. The steaming, which are here, you can see the person is sitting inside the particular steam chamber, which can be relieving the pain. Here the lady is sleeping inside this particular Bikos Vedanyantra steam chamber. So it can also reduce the pain. So these are the different modalities, Vedana, that is the steam therapy. Here, the management of pain can also be done with the Shastra Karma, which is called as the surgical operative procedures. Sushrita is globally known as the father of plastic surgery. Means he is the father. He initiated the treatment of different surgical conditions. He has recorded, there is a written evidence of different plastic surgeries which are done by Acharya Sushruta. So he is globally known as or accepted as the father of plastic surgery or surgery. So he had explained different surgical modalities of treatment to reduce the pain instantly. So the concept of pain, according to Ayurveda, with the modalities of treatment like Shastra Karma or the operative procedure, can also reduce the pain. For example, if there is the abscess, that abscess can be painful because of the collection of the pus inside the particular site. Why it is producing the pain? Because of the dying nose, the dying cells. The dying cells are producing the pain. So when the dying cells are producing the pain, there is the collection of the debris, that is the collection of the pus inside the particular localized area. It is again putting pressure over the surrounding structures, again reducing the blood supply to the fresh, healthy skin. So there will be pain. So whenever you let out the pus collected inside by just a small incision, by just a small cut through, can reduce the pain because the pressure will be relieved, the debris or the toxins or the pus which is collected will be removed, because of which the person feels relieved with the pain. He feels cool and calm. So the pain can be managed with the different operative surgical procedures. Here you can see the pain management with the Agni Karma. Agni Karma can instantly reduce the pain. Here on the right side of the screen, we are using the Shalaka. Shalaka means it is the Panchalohavan, which is made with the different combinations of the 5 metals. It is done, it is prepared, and it is used to put, or it is made into red hot, and we are giving the cautery, we are using it over the tenderful areas, so that the pain will be instantly reduced. Instantly reduction of the pain is seen in the patients. So we are giving it for about weekly once for different conditions, different ailments. Weekly one sitting for about 3 to 4 sittings can reduce the pain. Here the pain is reduced. Here in this case, the patient is having the this calcaneal spur, which is the small extra sprouty growth of the bone. Here we are doing the Agni Karma, which is the cautery, the mechanical cautery. Here on the left side of the screen, you can see that this is the modern, this cautery machine, cautery pen is there, and here again it is done over the molds for the cosmetic surgeries. So this is also Agni Karma. So Jalavakavacharna, this is the leech therapy, which is most famous one. Leech therapy. Leeches are having many of the medicinal properties. So it can relieve the clots. It can reduce the pain instantly. It can improve the blood circulation in the particular localized area. It can remove the discolorations. It can reduce the varicosities. It can improve the glow. It can improve the skin turgor. It can improve the skin's maximum polish. The wrinkling of the skin can be reduced. The charming or glowness of the skin can be regained. The pigmentations, the skin-related problems, hypopigmentations, the tanning of the skin can all be relieved by this simple application of the leeches over the particular sites, which can also improve the blood circulation and can be used in the reduction of the pain also, because it is having many of the chemicals which are there to reduce the pain. There are many of the articles in the internet, you can go through it. So this is the application of leech can reduce the pain. Generally, we are using this leech therapy in the osteoarthritic pains, which is the chronic pains. We can reduce the pain in the osteoarthritis. So here is the management of the pain with the Siravidana, which is called as the bloodletting procedure. Bloodletting procedure means the blood will be letted. So the Siravidana or the bloodletting or the venipuncture, what we'll say, it is called as the Ardha Chikitsa, the half treatment in almost all surgical diseases. This is the most important one, which is explained by Acharya Sushruta, the father of surgery. I'll just give you a simple example. You can do it practically. The pain which is produced because of the spinal disc problems, the disc protrusions, the herniation of the disc, the prolapse, the bulges, so which is causing this thecal indentation, the thecal sac indentation, or compressions over the particular nodes can be used, can be reduced. The pain which is related with all these things can be reduced by using the simple bloodletting procedure. So if you are using this bloodletting procedures in the disc problems, definitely this swiftly, immediately you will see that this is a magical treatment which can reduce the pain. They're having different videos on it. This is the bloodletting treatment. But the site of the pain, the different conditions related with the patients can be seen. Definitely it is. We have to select the particular patients, not done on all the patients. And all these procedures should be done under the observation of the medicinal, the Ayurvedic medical practitioners. The management of the pain with Vidya Agni Karma. Vidya means it is the pricking. The pricking will be done, and Agni Karma means we are using the cautery. So it can reduce the pain. The chronic pain can be reduced. Here on the right side of the screen, you can see that the Agni Karma is being done over with the needles has been pricked over the particular tender sites, and the shock therapy or the electrical therapy or the Agni Karma is being done. So it can reduce the pain. This is with the Agni Karma. So you can see here the management of pain with Basti. Basti means again we are putting the particular oils over the particular sites, disease site, or the Basti can be on the right side of the screen. You can see that enema therapy is also called as the Basti. Different Bastis. The Basti is the best treatment, which is called as the half treatment for almost all the Vata Vadis or almost all the painful conditions. We can use the different Bastis. Different drugs and different drug combinations are used, and they are named differently. So this is the best therapy which can relieve the pain. This is the Basti therapy. So here on the left side of the screen, you can see that the Hridaya Basti. Over the half reason, we are putting the particular medicinal oils to relieve on the ailments which are related with the heart. And the central scene, the central image is the Kati Basti, which is used to relieve the backaches, low backache. And right side, you can see that is the Basti, that is the enema therapy. Different medicines are used, different medical medicine drug combinations are used to relieve the pain. So the management of a pain with Marma Chikitsa. Marma Chikitsa means we are using the vital spots of the body, and we are reducing the pain. It is also done on the weekly sitting basis. 4 to 5 sittings can reduce the pains. So different pains can be reduced with these conditions. So the pain management with the Lepana. Lepana means we are using the application of the medicines or the kalkas or the pastes, medicinal pastes over the body. The body is used for smear with the medicines. It is the external application of these medicines will be done over the painful areas. Depending upon the different diseases, we are using this. Different drug combinations will be done and it will be applied over the body. So this can also reduce the pain. The local therapies, local applications can be done with this. The management of pain with Harshana therapy means we have to just give the happy news to the patients. We have to give some delightful stories or happy feelings or the laughings, which can improve the health of the patient. So just share my screen. So here we can see it. Different conditions which was again related with the management of the pain, which is giving the pleasure to the patients, keeping the patient very happily can reduce the pain. So Harshan therapy is keeping the patients in very happy mood, right? So this can reduce the pain. And here we can see that the pain can be managed with the help of these things. Just a minute. So I'll just share the screen. So here we can see the screen. This is the Harshana therapy. And then you can see that here. The next thing is related with this. So the next slide is here. You can see that the management of the pain can be done with the help of Ashwasana, which is giving the assurance to the patients that nothing will happen, you will become all right. So you will be all right within some ways, nothing will happen. Giving the assurance to the patient that nothing will happen, you will be all right, can reduce the pain. Just your assurance, the words of assurance can reduce the pain. So never let the patients to have the pain. Just give them the assurance that nothing will happen. We all are giving the best therapy for you, which can reduce the pain to the patients. So these are some of the treatment modalities which are done. So for more details, you can just log on to my channel, YouTube channel, Dr. Rakeshkumar Gujar. For more videos, Agni Karma, the cautery therapy has been explained. The Siravedana, which is blood therapy, has been explained. The manual inner vitiation, which can reduce the pains and the irritable lesions, can be seen. The IND, that is the incision and drainage procedure, which is the surgical operative procedures, can be done too. And you can see those videos for more details. And thank you for all of you for your patient hearing. I'm very much thankful to Dr. Shekhar for giving me an opportunity to present this, the concept of pain in Ayurveda, which is management. Also, I'm thankful to our college staff and principal, and also the MD and CEO of Gujar International Ayurveda Foundation's Ayurveda Australia, Dr. Rakeshkumar, my brother, for their kind support. The last take-home points are that the pain, the concept of pain in Ayurveda is completely different. So after seeing all these points, you are in an idea that you know the different types of pain, the different management operative procedures, or the non-operative invasive procedures to reduce the pain. The only thing is that we can reduce the pain by using simple concepts which can reduce the Vata dosha. The concept of pain in Ayurveda is related with the Vata dosha. But the concept of pain in modern science is not only related with the Vata dosha. It means the different features or the different characteristics of the pains are related with the Vata and the Pitta dosha. For example, I'll just tell you a simple example to finish this session. The burning type of pain is because of the Pitta dosha. If we are giving the medicines which can reduce the Pitta dosha or which can mitigate the Pitta dosha, can reduce the pain, can reduce the burning sensation of a pain. But if we are having the pricking type of a pain, pins and needle sensations, then it can be because of the Vata dosha. So we have to give the medicines which can mitigate the Vata dosha. So for a particular concept of a pain, for a particular nature of the pain, we are dividing it that this type of pain is because of Vata dosha, whereas the burning site of the pain sensation or the burning nature of the pain is because of the Pitta dosha. So we are using different medications for this, but in the modern science, they are giving the simple single medications, analgesics. Only thing is analgesics, NSAIDs. So the concept of pain according to Ayurveda is different, and which can definitely reduce the pain, not for shorter duration, but also can reduce the chronic pains. Still, the research works are going on in these concepts of pain, and I hope that this pain, the concept of pain and its management, is worthwhile for you. We have seen different modalities of treatment which can reduce the pain. We can adapt to simple medications, simple modalities, which can be done at home also, with the proper guidance of the Ayurvedic doctors. And thank you all. Namaste.